2020. Starting today will be Dr. Dart with the Tulsa Health Department.
Thank you, Richard, and good afternoon. To update everyone, today there was reported an additional 8 people who have tested positive for COVID-19 in Tulsa County, for a cumulative total of 653 people who have had COVID in our community. Unfortunately, that also includes a total of 36 residents who have passed away from this virus. That brings our death rate from COVID-19 to 5.51% here in Tulsa County. Also, since last Wednesday, we've been tracking the data. Our case trends have been going up. In the past, we had somewhat plateau, but now we are seeing an increase, and unfortunately, some trends are increasing significantly. While we take steps towards meeting each gate, our staff continues to do the work that we do to safeguard our community. We continue testing, and of course, by appointment only. If you would like to be tested for COVID-19, please call 918-582-9355 to schedule an appointment. We do have the capability to collect specimens on 200 individuals each day at our drive-through testing site. You do need to make an appointment, so please call us. Again, that number is 918-582-9355. We want to test. For other testing resources, individuals may also call their healthcare providers or visit drive-through test sites by appointments at OU Tulsa, OSU Center for Health Sciences, or the Walmart at 81st and Lewis. 211, as I'm sure everyone is aware of, is another helpful resource. It can answer COVID-19 questions and other assistance to those who are uninsured or underinsured. We have been conducting epidemiological investigations for all COVID-19 cases since the very first case was confirmed on March 6th. This week, we've expanded the team to now include nearly 40 public health professionals. That means we started with 3. We're up to 40 now who can assist with case notification, contact tracing, and risk assessments. We do know, bottom line, that by reducing the number of people a COVID-19 positive case comes in contact with, we can reduce the potential for virus to spread in our community. It's been amazing to see what's been going on in our business community. We applaud the innovative ways employers and other organizations in our community care about the safety of their employees, the volunteers, customers, and congregations by following guidelines. These guidelines are on our website for industry-specific businesses and contain general strategies to support the business and nonprofit community as we reopen to rekindle our community. We continue to offer support to restaurant owners for their employees on what these phases will look like while protecting the customers and staff's health. Our food protection program is available to provide consultation to any food establishment in Tulsa County. Call Tulsa Health Department at 918-595-4300 with questions, and consumers also can report violations that they might see using our website. The Oklahoma Blood Institute is facing the biggest challenge we've ever seen right now. According to OBI, our state has lost more than a month's worth of blood collection due to the pandemic. They need all the eligible donors turn out and give blood. They need businesses, faith-based organizations, school groups, and more to host blood drives. Of course, practicing social distancing guidelines as they do it. Blood is a perishable product that lasts only 42 days in the shelf. 1,200 blood donors are needed daily to maintain a strong blood supply for Oklahoma. Hospital usage is returned to normal. That's good news, but without an immediate increase of blood donations, the blood won't be available for these patients and their physicians. Make an appointment at obi.org or by calling 877-340-8777 to ensure no Oklahoma is without the blood they need. Today, we're celebrating National Nurses Day, which is celebrated in the course of National Nurses Week. We honor the critical role these men and women have in keeping our community well. Public health nurses have been a vital part in the prevention of disease and help us to promote community health and safety. We want to thank all our nursing staff, as well as all Tulsa County nurses who are on the front line. Make sure you thank a nurse today. As we start moving through the phases of reopening, it's crucial that people continue to follow social distancing guidelines to avoid another surge. Social distancing continues to remain our best defense against COVID-19. Stay at least 6 feet from others who do not reside in your home. For those who are older, who have underlying health conditions, our recommendation continues to be to stay home as much as possible or until spread of the virus is significantly reduced. For those individuals experiencing symptoms but do not need hospitalization, we ask you to continue to stay home until it's been at least 10 days since your symptoms began. You are fever-free for 72 hours without the use of fever-reducing meds, and all their symptoms have resolved. Contact your healthcare provider for recommendations regarding the treatment of symptoms or if your symptoms worsen. You know, we've had a lot of questions about masks and face coverings, so let's talk about that. I know there's been a lot that's confusing, a lot of confusing information has been out there. I want to be very, very clear that the point of wearing a mask covering the public is to protect those around you in case you have the virus. In public health, we're focused on protecting the health of the community, and by wearing a mask, you are showing respect to those around you, and you also are protecting them. We also know that Mother's Day is coming up this weekend, and historically, many people travel home to visit family. We ask that for this holiday, you celebrate mom in innovative ways to maintain a safe distance. Mail a card, call her on the phone, send a delivered meal, or have a virtual visit on your device. When we first started suggesting social distancing, many people responded positively, and that resulted in a heightened desire, and we saw some flattening of the curve. But after several weeks of the same message, I think the stress and anxiety over uncertainty of how long daily routines will be disrupted has left many individuals drained and numb to this guidance. And this caution fatigue is what's causing more and more Tulsans to grow lax about social distancing guidelines and potentially putting themselves and others in harm's way. We know this is hard. We recognize that staying at home is not sustainable. However, this virus isn't going away overnight. This virus is still here. So for now, we're going to have to find a way to coexist with this virus. We have to remain diligent in how mindful we are when it comes to personal hygiene, cleaning up highly touched surfaces, and importance, self-help. So you've heard all these suggestions before. I hope you're not tired of them because you're going to continue hearing them, and they're worth repeating. Eat a balanced diet. Keep a regular sleep routine. Get outside on these nice days and exercise. Stay socially connected to technology and find your own source of stress relievers. Creating a new normal can help bring a balance to the unease you might feel right now. Focus on the day by day instead of how long these restrictions may stretch on, because frankly, we don't know. We have to focus on the now. I can't say it enough. Social distancing improves public health by keeping you and your family safe while ensuring that hospitals can meet demands and more likely save lives. I would like to ask people, you know, I know we're all really tired of hearing we're all in this together. I want to ask people to be all in on following these recommendations to keep yourselves, your family, and your neighbors safe. The toughest part about this storm is that we don't know how long it's going to last. And for all the unknowns we have, this much is clear. We can't just hear, we need to listen. We can't just look, we need to see. We can't just know, we need to understand the reasons why we must remain vigilant and keep ourselves safe from exposure to COVID-19. Thank you, and I'll now turn it over to Mayor Bynum.
Thank you, sir. Please stand by. Mayor G.T. Bynum, City of Tulsa.
Well, I want to start by joining Dr. Dart in recognizing National Nurses Day and thanking all the nurses here in the Tulsa metro area who have courageously gone to work every day throughout this pandemic to keep Tulsans safe. I cannot think of anything that this community could have done over the last 2 months that would show our support for nurses in Tulsa like we've done by practicing social distancing and enabling our healthcare system to prepare to handle this pandemic over the long haul. And so for everyone in our community, thank you for what you've done to make it safer for our nurses in their jobs. And thank you again to the nurses for all you do to treat those who are in need. I have a quick update on how things are looking since we began phase 1 of the state's social distancing rollback program. We started along with other cities around the state on the 1st of May, last Friday, and over the weekend, things went pretty smoothly. I think that the main thing that we ran into was, you know, again, in something where we've never done this before, we had some confusion around what the definition of a bar is and where that might apply. But beyond that, everything went pretty smoothly. Our calls for service to the police and fire departments were pretty steady. And I've heard from a lot of people throughout the community and seen in local news reports of just outstanding work that Tulsa businesses are doing to protect their customers and their employees. So I want to thank all the businesses who've taken this seriously and gone about it the right way. And I want to thank all my fellow Tulsans who recognize that this is not over, that Friday wasn't some big celebration that the virus is gone, but rather that we're moving into a new era where we try and identify how we can minimize our risk with new practices that keep us safer, while also trying to allow our economy to re-engage. And so I cannot thank our businesses enough for the way that they have started out. And once again, you know, as always happens here in Tulsa, I feel like people just took it in a calm, business-like way and did the right thing. So thank you. Speaking of which, I also want to take an opportunity to talk about masks, because I don't think I've done a very good job of explaining why they're important. As Dr. Dart mentioned a moment ago, the purpose of wearing a mask in public is not so that you're protecting yourself. I think that some folks think that they're showing how tough and strong they are by not wearing a mask in public. All it's showing is that you don't care about spreading the virus to people around you. The purpose of wearing the mask is to try and contain the aerosolized droplets that are coming out of your mouth while you're speaking or sneezing or coughing, and prevent them from getting to other people. So if you want to spew your droplets all over folks, then don't wear a mask. But if you want to be considerate of people around you and help slow the spread of this, that's the purpose of wearing a mask. Another important update that I received this week was from our hospital systems here in Tulsa. Spoke with each of our major hospital systems on Monday, and what they told me, which is good news, is that their overall COVID patients that are hospitalized either have continued the downward trend that they've been seeing for 3 to 4 weeks, or at the end of that trend, they've kind of bottomed out and have remained stable for the last week or so. So we've not seen an increase in those overall hospitalizations in our local hospitals, which is good news. It means they're maintaining their capacity, and all of them reassured me again that they feel like they feel very confident that they have the capacity to handle this moving forward. Of course, we'll continue to monitor that capacity, and if it becomes a problem, then we won't hesitate to act, just like we did 2 months ago. But for right now, our hospitals are in good shape. And on a similar note, I had the opportunity on Friday to join the U.S. Army Corps of Engineers for a tour at OSU Hospital in downtown Tulsa at 7th and Houston, where they are outfitting 3 floors of that hospital building with about 120 beds that'll be strictly devoted to COVID-19 patients moving forward. This will not only increase our overall capacity locally in our hospital systems, but it will also allow us to focus all of those patients in one facility that's specifically designed for the treatment of COVID-19 patients, which helps reduce the burden on our other hospitals here in Tulsa. So I'm incredibly grateful to the state of Oklahoma and the U.S. Army Corps of Engineers and OSU Medical Center for taking on this work and further increasing our local capacity and our ability to treat those that are in need. A lot of folks ask about testing, and that's certainly, as we move ahead into this new phase of reopening, that continues to be incredibly important. I want to thank Walmart. As a lot of you know, they had opened a facility at 81st and Lewis that people could sign up by appointment to go get tested. That has been so successful that Walmart is now opening a second facility at Admiral and Memorial, and they're taking appointments for that testing facility right now. So if you'd like to sign up to get a test at either of the Walmart locations, you can go to doineedacovid19test.com And we'll put that link on the City of Tulsa website following this briefing. Or you can call 1-800-635-8611. Lastly, as we move forward in this economic revitalization for Tulsa, I've established the Mayor's Economic Recovery Advisory Committee that is composed of people from industries throughout our community that are helping me identify what the things are that we need to be doing locally to best support economic recovery for all sorts of different businesses in Tulsa. As part of our work on that front, it's very important that we hear from businesses throughout the community and how you're doing, what you think your greatest needs are, what would be most helpful to you. And so we are distributing a survey that we would really like any business owners to go ahead and complete. It will help inform the work that we are doing in partnership with the Tulsa Regional Chamber. And you can find that link at cityoftulsa.org. You just go on it and the COVID-19 bars at the top, click on that, and it'll take you to the survey that can be completed. Again, I just want to thank everyone in this first 5 days of our economic recovery and reopening Tulsa. How smoothly it's gone is a testament to the, I think, stoic, calm, deliberative nature of Tulsans and our business community. And as Mayor of Tulsa, I can't thank you enough. Thank you.
Thank you, Mayor Bynum. Please stand by. We'll bring Chief Franklin up. Tulsa Police Department Chief Franklin.
Thank you, Richard. Thank you, Mayor Bynum, Dr. Dart. It's been more than 7 weeks since the COVID-19 outbreak forced us to change our lifestyle. It's not been easy. Our community has adopted changes for the sole purpose of saving lives. And although the orders have been unpopular with some members of the community, it's been enacted for the safety of our community. As our community begins to reopen, we urge everyone to simply exercise good judgment and gather and interact with others responsibly. Businesses should follow the guidelines laid out by the government officials. Although our hospitals now have the capacity to handle patients, we don't want to needlessly fill those beds with senseless acts, and the threat of the virus is not over. So let's be smart and let's not let up just yet. Enforcing the laws has been very difficult for us. And under some of the best conditions, it's been challenging for law enforcement to balance those societal norms with the temporary measures of restricting those norms. So as our community returns to a more normal level, so will the Tulsa Police Department. And we've seen reckless disregard to safety on our roadways, and that's led to an increased number of collisions on our highways. Potentially like the deadly virus, a driver who speeds or runs a red light is just as dangerous to our community. So whether it's a COVID-19 or a traffic collision, once you're dead, you're dead. So our traffic officers and our motors are back out there on the highways. If you've been on our highways, you've seen them there. We will continue to enforce that because that is part of our safety measure. And also, unfortunately, the violent crime didn't disappear in our community during the pandemic. We have remained present with we have very effective investigators. We have patrol officers that have maintained high clearance rates on our violent crime. Year after year, our clearance rates for homicides have been above 90%, which is very favorable to the city of Tulsa. But as we continue to move through this, we are going to continue to enforce laws and ordinances on our books. We're going to continue to provide that safety measure that you as citizens need and deserve. And the Tulsa Police Department will continue to partner with agencies and businesses in response to the COVID-19 pandemic. I also just want to point out to the nurses that you won't get a ticket from me. So you never know when I'm going to be in need of assistance from a nurse. So thank you, Tulsa. Stay safe, stay healthy, and I'll turn this over to Commissioner Karen Keith.
Thank you, Chief. Please stand by. Tulsa County Commissioner Karen Keith.
Thank you, Chief. I appreciate what you said for the nurses. That's really great. A few updates here. Last Friday, the Board of County Commissioners reached out to every city manager in the county regarding the federal CARES funding with an invitation to request reimbursements for COVID-related expenses. Now, this effort included personal phone calls to ensure that area communities understand that Tulsa County is ready and willing to help as allowed by the Department of Treasury. The county clerk, Michael Willis, is tracking all reimbursable costs from our municipal partners and is working with the governor's administration to make sure appropriate costs will be considered for reimbursement. The Tulsa County website will have information as it becomes available, so check on it every once in a while. In other news, the courthouse officially reopened to the public yesterday. That said, I want to remind everyone that if you conduct business electronically or over the phone, please continue to do so. The district courts are closed through May 15th, but they will reopen Monday, May 18th. And the county is looking for ways for the courts to reopen and do it safely. As you know, this is a vertical building with just 3 elevators, and it's ill-suited for social distancing. So with the help of the health department, we'll be looking at best protocols to safely accommodate the public. Our judges are also looking at ways to reduce the number of folks being called into the courthouse. So if you need to come to the courthouse, we encourage you to wear a mask for your safety and the safety of others. Now, I'm also pleased to tell you that following the opening of the La Fortune and South Lakes golf courses and grills on Friday, as well as the Case Tennis Center at La Fortune, our parks director reports that he witnessed nearly every visitor adhering to the new social distancing guidelines while enjoying the outdoors. The grills at both golf courses continue to be open for takeout and are a great option to enjoy the outdoors while taking advantage of the patio seating. Lastly, the Parks Department continues to evaluate the phased opening of our rec centers, aquatic areas, and playgrounds. And any decision made will be to ensure that we provide the safest environment for our citizens and our staff. I'd like to specifically thank all of our park staff and partners who worked through the past 6 weeks to maintain a safe outdoor environment and also ensured a very smooth and quick reopening. Now, here's my challenge for you. Whether you're running into a quick trip to the grocery store, the hardware store, or our courthouse, wear your masks. You are protecting those that you may encounter. Now, this will become routine, so have some fun with it. Folks are getting creative with their masks. My sister made this one for me. I love it. It's a wonderful, bright colors. So you can have fun with this too. But bottom line, I'm asking you to do it for all of our nurses as we celebrate Nurses Day today. Those masks will help keep them safe and the numbers down in our hospitals. So I ask you again, please stay safe and stay healthy. Thanks. And now Sheriff Vic Regalado.
Thank you, Commissioner. Tulsa County Sheriff Vic Regalado.
Thank you, Commissioner. Thank you, Richard. We continue to be remain COVID infection free among our inmate population, and equally positive as we've had no sightings of murder hornets. Our inmate count is 1,092, which is still below our average of around 1,400. We continue, we hope to begin testing of our new bookings as well as our inmate population next week. The COVID testing will consist of nasal as well as saliva test. And I hope that that gives us an insight, especially as it concerns asymptomatic inmates. And it's a true testament to our detention staff that we've been able to remain COVID-free in the jail. Most jails across the country have not been as fortunate. And in fact, I think, again, a true testament to the professionalism and the hard work of our detention staff. Our COVID-19 response plan has been requested multiple times from large jails around the country. However, that being said, as we continue on, what could affect that in a negative standpoint would be an increase in our jail population. I'm going to give some numbers that give an idea of what's going on with our inmate population, but understand that there are certainly variables that would impact these numbers. But and between April 1 and May 4th, we have had 910 bookings. Of those bookings, they're comprised of crimes like assault and battery, burglaries, domestics, and homicide arrests. So it's violent crime. Larcenies are down for the first time in quite some time, but I think it's easy to surmise that there haven't been any businesses open. In March of 2020, we had 1,384 total inmates released. In comparison, and that's in the average monthly, it's around the average monthly releases. But in terms of bookings, again, we had 910 between April 1 and May 4th. The same time period in 2019, we had 1,745. So again, we're still well below the average, but as we continue into the summer months and as we continue to reopen, I believe we will see an increase. And again, that will affect our ability to run our safety pods within the jail, which again would negatively impact our ability to remain COVID-free. But we will continue on and certainly keep everybody abreast as our situation may or may not change. Lastly, Commissioner Keith touched on it a bit. The courts will be opening May 18th. And there are certainly a backlog of court cases and dockets and things because of the COVID-19 crisis. And as we continue to plan on how we are going to conduct courthouse operations when that particular day comes, we will keep everybody abreast and disseminate information as it comes in leading up to May 18th through social media, our daily briefings, and hopefully the media. But again, I would also encourage that when that day comes, that we ask people to be responsible, wear masks so that you don't, to quote the mayor, spew your droplets all over our courthouse and infect our staff or your other fellow citizens. So we would ask you to keep that in mind. And again, we will keep you informed as we draw closer to May 18th. Thank you, and God bless everyone.
Thank you, Sheriff. Please stand by. We'll bring all of our panelists back for questions. All right, we'll now be taking questions from the media.
Our first question is for Dr. Dart from OETA. Blue Cross Blue Shield is offering its mobile carrying vans to help increasing testing in minority neighborhoods. What is your reaction to that, and what are the benefits of the program?
You know, it's important, as we've been saying, that everyone who needs a test gets a test. And if there's access issues, having a mobile facility allows us to go into neighborhoods, to serve people where they are instead of having them come to us. So whatever we can do as a community to make testing accessible, we support, and we appreciate any partnership that helps us respond to COVID-19.
Okay, Dr. Dart from Tulsa World. Could you elaborate on what we're specifically seeing trend upward in Tulsa County?
So basically, everything is trending up. We do a 14-day trend of just case counts. That's trending up. We do 4-day rolling averages. We do 7-day rolling averages to give us an idea of what we see on both a daily basis and cases over time. At this juncture, even with the expanded testing, it's important that we start to see cases go down so that we really know that viral activity is going down. And unfortunately, that's just not what we're seeing so far.
Okay, for Dr. Dart from Fox 23, the makers of the drug remdesivir donated their entire stockpile of drug to the federal government, and we heard FEMA was working to distribute that small stockpile to countries across the country while more is being made. Has Tulsa Health received any kind of guidance on how to get the drug, and is Tulsa Health trying to get some doses of it?
I think it's, from all the data I've seen on this, it's still anecdotal. I think there's some positive results. We have to remember that this drug is not a cure for COVID-19. This drug treats the symptoms related to COVID-19. And frankly, we don't know enough about the acuity of this drug to I think, release it on a broad scale. We're still continuing to follow the data, and if this is a medication that works effectively, of course, it's something, a tool that we'll use here in Tulsa County. At this juncture, I personally don't have a lot of confidence that that's the case. I love that we're receiving positive data on it. It's much, I think, much better to know what the drug actually does, and we won't know that until it's studied greatly or more in-depthly over time.
Okay, for Mayor Bynum from Channel 8, you've made it clear that the city will enforce restrictions aimed at curbing community spread. Have police or any city agency handed out any citation, and how are you monitoring compliance?
So we're monitoring compliance the same way we do compliance with any law that we have in Tulsa, which is largely driven by reports from citizens of violations of it. Chief Franklin might be able to give you better detail than I can up to today on numbers, but my understanding is that our officers, most of what they've spent any time on relative to reports of complaints on around this over the weekend were either working out, differences of opinion as to what defines a bar, or just educating people, which is what our officers in the field spent a lot of time doing when we ramped up our social distancing restrictions as well. So, Chief, anything you'd want to add on that?
Yeah, I would just say that we are monitoring our enforcement activity. And to my knowledge, we have not had any enforcement of the latest civil order, other than, as the mayor mentioned, we have had, when this first came about this past weekend, we had some differences and had to work through some legal issues about what is a bar and what's not a bar. And so we got direction from some of our state agencies to assist us in that. And to my knowledge, thus far, things have operated smoothly.
Okay. Dr. Dart from Fox 23. With things reopening, but the virus still being out there, will testing continue at all current locations for the coming weeks and months ahead? Or are there any contractual obligations that could cause these places to close in coming days?
I can only speak to the testing pilot that the Tulsa Health Department does. Healthcare systems, I know this is their mission. They'll continue to test. I'm not really sure how long OU and OSU will keep on testing, and Walmart, we know, has a finite and has an end date. So bottom line is that as a community, I think Tulsa County has done a great job of standing up and responding to viral activity, and that's not going to stop. Where testing will be going forward, I think the environment will tell us, but we'll test as long as we need to, and we're not going to stop until we're no longer at risk for the spread of this disease.
Okay, Mayor Bynum from Channel 8. Do you anticipate issuing an order to require people to wear masks like other cities have done?
No, I don't, and for two main reasons. One, I think it's largely an issue of individual responsibility, and the cities that I'm seeing that are doing it best really are keeping it focused on a strong recommendation. More importantly than any of that, though, is that if as a city, if you're going to say that everyone has to wear a mask, then you have to be able to provide masks for everyone that can't afford to either buy one or make one themselves. And our focus when it comes to masks to date has, and it's been a largely all-consuming task for a lot of people on our team at the city, and I know at the county and at Tulsa Area Emergency Management Agency, in procuring masks for first responders and healthcare workers. And the idea that we could, beyond that, knowing how challenging that has been on its own, the idea that we could also get masks for 1 million people in a metro area just isn't realistic. And so, no, I do not plan to make it an ordered requirement, but it is something that I certainly believe, as I said earlier, that if you're considerate of the people around you, you would wear it.
Okay, Fox 23 for Mayor Bynum. Do you have any city-specific data on the city of Tulsa's unemployment rate and how many jobs have been lost just in Tulsa just in the last month?
I don't have that right in front of me at the moment.
Okay, Chief Franklin from Channel 8. Last month's murder rate compared to 2019 did not decline despite stay-at-home orders. Is there any sense as to why that's the case?
Well, we've batted that around up here in my office for quite a while, and there's nothing that you can pinpoint to say this is why our homicide rate has increased. I think that we have, in law enforcement, we have a number of different tools that we use in order to keep the community safe. Some of those tools have been taken away from us, particularly during this pandemic, that don't allow us to utilize some of the other things that we would normally do. Arrests that we would normally have on lesser offenses are not occurring. Those might be keeping some of our suspects or even our victims out into the community and make them more susceptible to violence. So there's no real pinpointed way to show that that this social distancing has caused an increase in violence. We normally have a surge at this time, and it just so happens that this surge is occurring during the pandemic.
Okay. Our next question is for Chief Franklin from Channel 8 and KRMG. They'd like you to clarify what is a bar and what is not a bar.
Well, we use the Able Commission's guidelines in determining what a bar is, and that is essentially if they get majority of their revenue based on liquor sales, then that is considered a bar. If they have other aspects of their business, whether it's restaurant, food, or whether it's dancers on a stage, then they would not be classified as a bar.
Okay. Commissioner Keith from Channel 6. The Department of Housing and Urban Development gave more than $500,000 to the city of Tulsa. How is that money going to be used?
Oh, you're muted, Commissioner.
You want to address that?
Do I want to address that?
They gave the money
The
to.
county,
Maybe
question was
restate the
aimed-
question. I'm not sure. Restate the question.
The question was for Mayor Bynum or Commissioner Keith
Oh, okay.
from Channel
Okay.
6. Sorry, I didn't clarify that.
Yeah, no, I'm happy to address that. I mean, the bulk of what the city of Tulsa has received in those funds is going to operate the emergency shelter that we've established in partnership with Tulsa County to allow social distancing in both the day center for the homeless during the daytime, and then also to provide overnight shelter that's being operated by the Salvation Army. So most of what we received from HUD for our emergency shelter grant is going to operate our emergency shelter in this time.
Okay. Fox 23 for Commissioner Keith. With the courthouse being one of the busiest buildings in downtown, has there been talk of purchasing disposable masks for use, or is it just too expensive to do?
We're talking about everything. We've got a group that will that has been meeting and will continue to meet. And Dr. Dart has graciously agreed to come look at the protocols we have and the ideas that we put to paper to see if it makes sense. And at the same time, our judges have been working to try to bring the number of cases down, because we're inviting people to come to the courthouse by virtue of going to meet before the courts. So we're trying to bring those numbers down so that we don't have a huge concentration coming in here all at once. But, you know, you're right. This building, a lot of people come through here on any given day. And with the courts being shut down, what we realize is that on the 18th, Sheriff even referenced this, we know we've got to do some things to mitigate the number of people coming in here. We have 3 elevators, we have an escalator. So you may see things like one staircase. You can go up that staircase, you're going to have to come down another. The entrances may be open for specific things, but those are all issues that we are trying to work out with the help of the health department.
Okay. Dr. Dart from Channel 2, are you concerned about a second wave of COVID-19 in Tulsa County, and how are you preparing for that second wave?
You know, I think as we reopen, it's just natural to expect that a second wave, or at least a surge from where we truly are. And, you know, all of our pandemic planning contains this surge plan so that we have to ramp up. We can ramp up. For example, we started this response with 4, or actually 3 epidemiologists who are doing contact tracing. We're up to 40 now. So our planning includes a surge or an increase in cases, and knowing that we'll have to also depend on community partnerships, because this has never been just a health department response. This has been a community response, a county response, and our partners have been tremendous. So we know that this is not going to end anytime soon, and we're going to see peaks and valleys as we go forward. Our hope is that this virus starts to take a more seasonal approach and starts to diminish, knowing that if it does this fall, we are fully expecting a surge, and that's what we've been hearing from both our federal partners as well. So whatever it brings on, I think our county and our city and our community and our agency has the ability to respond to it.
Thank you, Dr. Dart. That will conclude our COVID-19 conference for Tulsa County and Tulsa City. Please stand by. We're moving to a second part with G.T. Bynum in reference to Navistar. Mayor G.T. Bynum.
Great, thank you. I just I'm getting a lot of questions from local media, and thought this would be a good venue to address those, and then be happy to answer any questions that you have. The city of Tulsa, about 20 years ago, entered into a contract with Navistar. The city of Tulsa has a industrial facility out at the airport. It's about 1 million square feet. And the city at that time decided to lease it to Navistar for $1, not $1 a year, just $1. And that seems pretty extraordinary when you're talking about 1 million square foot facility for $1. But the ask, or the requirement of Navistar as part of that lease is that they would hit benchmarks as it relates to employment, which they've done, and also that they would properly maintain that facility moving forward, which they have not done. Their contract with the city was up for renewal, and as part of that renewal process, we had an independent engineering firm go into the building to assess the maintenance needs there. And what they found was millions of dollars in deferred maintenance in that building. And contrary to the way it's been spun in the last 24 hours, we're not talking about beautification here. We're talking about electrical systems on which that building relies. We're talking about roofing, which prevents or really protects the integrity of the entire facility. We're talking about the structural integrity of that building and millions of dollars in maintenance needs there. So we brought this report and these needs to Navistar's leadership and said, hey, here's what our independent expert says, but we don't want you to just take our word for it. Send your own person in and look and see what they think. And Navistar's independent engineer went through and found largely the same things that the independent engineer that we had sent in found. Same kinds of maintenance concerns. And so my office began discussions with Navistar about how we move forward and recognizing not just the need to catch up with the maintenance that had not been done under the terms of the contract, but we want Navistar to be here for decades. We love having the workforce here, the jobs here. We're proud to have those buses that go all around the world made here in Tulsa. But we recognize that we can't keep them here for the long haul if the building gets run into the ground. It has to be safe for them to occupy. I also think it's very important to point out that every dollar that is paid for either maintenance or proposed to pay under a lease payment goes back into that facility. It's not going to the city of Tulsa to give people raises or anything like that. It goes into a building fund specifically for that building to maintain it for the long term. And so we started discussions with Navistar, and I think there's been a lot of confusion in the last day, and I hope it's not intentional. There's been people saying that I and my office have tried to evict Navistar. I sat at a table with Navistar's senior leadership not a foot away from me and told them that we want them here for the long term. We want them to be successful in Tulsa. We just want our building to be maintained properly as well so that it can best serve them and their employees and keep them safe. And so we had that conversation. They seemed amenable to that, and we agreed that we should develop a plan moving forward. Now, as part of that, if you have a lease with someone for 20 years, and the main financial requirement of that lease is that they maintain a facility, and then they don't, should the city of Tulsa just extend it another 5 years and say, oh, gee, okay, we'll just continue to do that? That wouldn't be financially prudent. It wouldn't be good stewardship of that facility. Also wouldn't be fair to Navistar. And so what we said was, rather than continue a lease which appears problematic on your end, let's renegotiate a lease where we can have specific maintenance benchmarks moving forward. And that's the discussion, the negotiation that we've been in for several months. In fact, we're scheduled to meet tomorrow on that. Everything to date, from my vantage point as the mayor, has been very positive because we have, I think, a win-win here. We want those jobs here in Tulsa. We want Navistar to be successful in Tulsa. But we also want a building that is safe for the long term for them to be successful in. And so that's the discussion and negotiations that have occurred to date for whatever reason. And for the life of me, I don't understand why. But they chose yesterday, using a PR firm out of Chicago, to launch some sort of public relations campaign locally that is just grossly misinforming their employees about these negotiations and telling their employees that I'm trying to evict them. That is not true. And why they would say that to their employees and frighten their employees and their employees' families in the midst of this current economic crisis, for the life of me, I can't understand why they would do that, other than it's a hardball negotiation tactic. It's also very cynical. So we will keep working with them in good faith. We want them here. We want those jobs here. We want those buses built here. And we believe that it's in their best interest and our best interest to have that facility properly maintained moving forward. That's all we're asking. Not looking to, go back historically and second guess a lease that gave them 1 million square feet for $1. We just want them to properly maintain the building that they got that lease on. I'd be happy to answer any questions that people